Think beyond traditional business banking. Think a partner that gives you in-depth financial insights.
Welcome back. The agenda on the table today is Africa's pandemic preparedness. The recent COVID-19 pandemic exposed the continent's vulnerabilities to mitigate against the blow of a major health outbreak. Africa had to queue in line to receive vaccines that took a whole lot longer to arrive because of political challenges that saw major Western countries prioritize the health of their own citizens first. Given that Africa imports almost all the vaccines administered on the continent, we had no choice essentially but to wait our turn. But Africa now hopes to strengthen its vaccine manufacturing ability in the next decade, and so we ask, what will it take to ensure that happens? We unpack the major lessons learned from the COVID-19 pandemic in responding to a health crisis. We look at the case for investing in research and development in Africa and the role of government and the private sector in supporting such research. I am joined at the table today by Stavros Nicolaou. He's the Senior Executive at Aspen Pharmacare Group, Dr. Amadou Sall, who is the CEO at the Institut Pasteur de Darkar and the Chairman of the Global Outbreak Alert and Response Network, as well as Morena, Makhoana, who is the CEO at the BioVac Institute. Gentlemen, to all of you, thanks so much for your time. Stavros, I want to start off with you and just reflecting on the lessons, the major lessons learned from the pandemic. So in the event that we had to face another pandemic to the same scale as the COVID-19 today, would we respond in the same way? And if the answer to that question is no, what should we do differently, just based on some of the major lessons you learned?
Fifi, firstly, our response was a mixed one on the continent. Mixed because there were certain things that we did correctly, particularly here in South Africa. So let me not cover what worked, because we know what worked. Let me rather focus on two deficiencies.
Sure.
The first is not having capacity and capability to produce our own vaccines and medical countermeasures, as we call it. And our countermeasures include testing kits, diagnostics, and the likes thereof, as well as therapies for treatment. So we didn't have our own capacity. We had very little capability, very few technologies. And even when we did, as in the case with Aspen, we at record speed put up these capacities, vast capacities. The international and or multilateral procurement agencies landed up not buying these vaccines from us. Instead, we landed up getting vaccines from elsewhere. We were importing vaccines into the continent. So, single biggest lesson, you cannot be reliant on the rest of the world. You have to have your own capacities and your own capabilities. Now let me just segue into the second and final point I want to make. So I'm sure the other colleagues will add to this.
Sure.
It's no good putting up capacities on the continent if we cannot sustain these capacities. So it won't be the first time that there's been a discussion around putting up capacities. And there are many examples I can cite. There are mothballed plants in the DRC that go back to the Belgian era even. So this is not a new phenomenon. So the single biggest intervention that's required right now is a reorientation of the global procurement of vaccines so that Africa procures vaccines for Africa from African producers.
Okay.
Now, if you do that in itself, that is a major contributor towards strengthening healthcare systems, because that was the other weakness. And I think I'll reserve my comments on that for later perhaps. But if you get proper vaccination, you've got proper testing, and this is all digitally linked, right? Then your healthcare systems are more appropriately equipped to manage what becomes quite a frenzied situation.
Okay. So let's park that there for now. We'll come back to some of the points that you have raised. Just, Morena, just wanting to also get your thoughts here, just given the fact that BioVac also played quite a instrumental role in the response of South Africa, specifically to the COVID-19 pandemic. What would your single biggest lesson learned from this experience be?
Yes, thanks, Fifi. I think it's really about preparedness. And this preparedness is really, it's just not preparedness on paper by saying that we have a plan, but it's really acting on that plan. And some of the plans you don't really need to wait for the pandemic to actually arise before you act on them. You can act on them way ahead of that, so that the paper matches the action. So we were caught off guard. I mean, as Africa and most of the developing world, as we know, our health systems were just not prepared. This is despite having the likes of Ebola that we knew in many parts of the continent highlighted the lack of health systems. And this was back way in 2015, 2016. But we were still not there. So on the health system side, I think health systems in terms of hospitals and essential care for a pandemic, we're just not prepared. And I think we would still have the same issue when it comes to that. What we were also exposed to in the pandemic that was, I think, quite new for all of us was around even issues around vaccine hesitancy. So whilst we thought that because we immunize our children and we get 80 to 85% coverage, we thought that once the vaccines come, which came late, once the vaccines come, that they would easily be absorbed. Now, part of the issue with vaccine hesitancy is that the vaccines did come late. And so that's one of the reasons, because by the time it came, there were all sorts of rumors and all sorts of, people had made up their decisions. So if we prepare and make sure that we get many vaccines quicker, which essentially goes back to the vaccines being manufactured on the continent, that is essentially where we need to be, and I echo what Stavros has said. It's interesting, Fifi, that I'm not sure if your viewers would be aware that the EU, which obviously has a lot of capacity, have their own pandemic preparedness to a point that in the last few months, they have reserved 325 million dose capacity to European manufacturers. Now, this is an example, and I'm not saying that it would be nice if the African continent was to do the same. But the point I'm getting to is that let's have plans that are written down, but let's act on it. And so by the EU having a plan, but acting on it and reserving capacity for a future pandemic is an example of how we need to turn our theoretical plans into action. That's the only way that we can get prepared going forward. And again, whether it's about vaccine manufacture, it's about diagnostics, about testing, it's really converting these plans into real action.
Okay. Amadou, I'm hoping that you can just help us understand how it is that we got to this vulnerable position as a continent. Right now, as has been echoed by what your fellow panelists have said, we practically import all the vaccines that are administered on the continent. We only but manufacture 1% or so, according to some of the latest numbers that I've seen. And I'd like your thoughts on that, sir, and how it came to be that the continent found itself in such a vulnerable position.
Thank you very much. I think this question is quite important. Let me just say a few things about that. In Africa, the capacity to make vaccines and to make those tests is something this is feasible. I just want to be very concrete. Institut Pasteur de Dakar has been making vaccine for 80 years. It is a WHO pre-qualified vaccine doing end-to-end manufacturing. And this is sold at the global level with yellow fever vaccine. Similarly, during the COVID pandemic, over like few months, we put together a pilot plan that make rapid diagnostic tests among the first in the world available. So the feasibility, the capacity in terms of intelligence, human resource is there. It's just making sure that making this sustainable is possible, and also making sure this is to the level that it serves the continent, to the level it gets to the self-reliance. Now, what are the major obstacles why we are not getting there at the level that we can rely on ourselves or in our continent capacity? I think number one is we need to work out the ecosystem. Very clearly, when we talk about regulatory, when we talk about human resource, when we talk about intellectual property, and when we talk about R&D, we still have a lot of weaknesses that we need to work out with major stakeholders at the continent, global and national level. Number two, beyond releasing those, we should make sure that we have a real plan, as said by Stavros and Makhoana, to make sure that we are building for the future. Africa is going to be the youngest continent very soon, and we should understand that health being a matter of security, we should really be careful about making sure this is sustainable. How do we do that? Number one is obviously funding, because, and when I say funding, it's more about the R&D and the capacity, because making vaccine end-to-end is something, making sure that the disease that we care and that may become a pandemic problem is about really investing on R&D on those threats and making sure we can get medical countermeasure, whether it's vaccine, diagnostic, or therapeutics. So funding for more investment into R&D is critical, and to make those projects is very important. Number two, which is also very, very important in terms of releasing that energy that is feasible and possible in Africa, is really making all those products would make no sense if the market and the procurement process is not making sure that financially those units are viable. So to come to the point that Stavros was making sure that all the mechanism, innovative idea, whether it's about premium pricing, whether it's about reservation of part of the market for African manufacturer, or helping that ecosystem to emerge in terms of manufacturing, R&D, and capacity to sell, for me, it's a very important point. We should focus beyond just discussing the different challenge that lead us to produce only 1% of the capacity of the vaccine in Africa.
Sure. So to build and strengthen the resilience of the continent's vaccine manufacturing capability, the Africa CDC is looking to essentially increase our position of manufacturing from 1% to 60% by 2040. Ambitious targets, but my question to you, Stavros, is how do we get from 1 to 60?
Okay, the answer is that if we have the appropriate support, it's readily achievable. Now, let me tell you why I have that confidence. I say so because Africa roughly consumes, I'm just going to round off the numbers, around 20 antigens, right? Mm-hmm. So we know which these antigens are. There's been a lot of work that's been done to quantify the volumes of these antigens. And yes, of course, you will always get outbreak situations, and you'll have to configure how you do, how you manage outbreaks. But the consistent, steady demand for what we call largely pediatric vaccines is readily available, all that data. So we've just got to ensure that we land the right technology partners on the continent to produce these vaccines, these 20-odd antigens that I'm referring to. That's number one. Number two is we need sort of less talking and more action here. So post-haste, we need to get the procurement agencies to start procuring locally. I can tell you, my company Aspen right now is in a position to sell vaccines to these agencies. Okay. There's a couple of steps that are needed, such as WHO pre-qualification, which is the third thing I'm going to come to in a minute. But suffice to say, if we get the procurement processes right, and procurement processes means two things. It means the international agencies procuring from African producers for Africa. But secondly, it also means the governments on the continent, the health departments on the continent, also procuring from our own African vaccine producers. So those are very important steps. And then lastly, I mentioned WHO pre-qualification. What does this mean actually? This is a mechanism to provide uniformity and consistency in quality, safety, and efficacy of these vaccines. But it is an incredibly onerous process. And what we as African producers are advancing and are in conversations, particularly through the Africa CDC, is to say, but if we get our own products registered here in South Africa by SAPRA, now we have on the continent what we call 5 maturity level 3 regulators. If we've got that on the continent, why do you have to go through 54 additional hoops, so 54 countries, and also WHO pre-Q before all of that? So what the call here is, simplify the regulatory processes. So you do not delay neither access nor manufacturing of these products. Okay. So that would be my plan. You get all of that right, Fifi, I think you can actually get beyond 60%. Okay.
Morena, do you agree in the confidence that Stavros has to essentially move the continent from being a serial importer of vaccines to one in which we are able and capable to doing so ourselves? I mean, essentially, he's spoken about the right support and the framework that needs to be put in place in order for that to happen. It will be possible with the right technology partner. It will be possible with the right procurement processes, and it will be possible with the sufficient dose of regulation. It seems like there's a bit of OD in terms of regulation as it stands right now. But just your thoughts on getting to from 1 to 60%, and what you think is required for that to happen.
No, absolutely. I think I agree absolutely with Stavros's view in terms of, firstly, that it is possible. But I think, how we are, as we're getting the viewpoints here, I think it's clear that not one magical thing is going to make us go from 1% to 60%. There's an ecosystem that is needed to do that. And that ecosystem relies on the things that Stavros has mentioned, like regulatory, like the procurement side. We also have the skills side, where we need to attract and retain the skills. And obviously working in the highest standards of technology, where we also need financing and patient financing, financing that really understands that to build capability is just not going to take 5 or 10 years. I think what is important is for us to aim to go from 1 to 60%. But also, I think the critical thing is, how do we retain that number or even exceed it? I think it would be tragic for us to try and shoot up only for it to come down at some point. So I think it's about attaining that number, that magical number, and sustaining it. I think that is key. And that's where we really need the ecosystem to really be conducive enough. And this is not a health matter. I mean, this is where we need ministries of finance to understand that we are actually creating a bioeconomy, and when we look at the various hubs, the global biotechnology hubs in the world, whether you look at South Korea, you look at California, you look at Europe, there's a whole system and a whole economy that has come around this. So whilst we are solving for pandemic preparedness, and whilst we are, just talking about vaccine production, but there's a much wider ecosystem here that would benefit from all of these initiatives.
Mm-hmm. And Amadou, do you think that there is there is comprehensive support for this ecosystem to function to its best ability, an ecosystem which the multinational institutions are also part of, in ensuring that they procure vaccines from players on the continent for citizens on the continent, an ecosystem in which governments on the continent are also supportive of, in also ensuring that they procure vaccines that are made here for fellow Africans. Is there political and business support and will for such an ecosystem in your view, and how can it be strengthened?
Yeah, I think there has been a huge political will in trying to move that agenda, because I could see really Africa CDC coming with head of state coming and being very clear on how this should be supported. Today in Africa, there is very important project. I mean, where in different countries, there is credible project that is moving on to make sure that they can do. So I strongly believe the political will is there. My question is, if you want to reach that target, it has to be significantly actually followed by real action. When I say real action, it's implied that beyond actually all this very important declaration, we have a real roadmap that would help us actually convince the procurement agency at the global level and look in the governance of all these different organizations and the global governance, a coordination that would make sure that making Africa in a position, putting Africa in a position where it can provide vaccine to the population of Africa, made in Africa, is a matter of being really reaching a much safer world. This is a health security problem. So putting really our money where our mouth is for me very, very critical. Today, there have been investment, even though some of the investment are not enough. The one that is available is kind of difficult sometimes to access. So there are tremendous effort being made. But my real point is we should be sure that if we want to reach the target in 2016, we have to make sure beyond the political will and putting funding to build all different mechanisms to speed that process. One thing I just want to also mention is the quality of partnership you should have. Nobody can build this alone. And when I talk about the partnership, we want to make sure that all the different players are working toward that goal. Africa CDC can be a great coordinator, but as Stavros and also Makhoana has noticed, the national involvement to put budget where it is needed, to make sure that they bring procurement contract to the different players and have our coordination working well would be really, really important. So that's why I think also, like all my colleagues, this is reachable, this is feasible. It is happening, but it needs really to be amplified and it needs to be sustained over the sort of like the next, I would say, at least 10 years to make sure we can see that result.
Sure. Perhaps also provide your thoughts on whether you reckon that there is support from all players to ultimately strengthen the resilience of the continent in ensuring that it can keep itself healthy, right? But also to the point that Amadou was making about this nationwide, Africa-wide coordination, which I imagine now has to extend even beyond the continent and even include some of our BRICS partners and new BRICS players coming to the table. So the complexities potentially of this Africa-wide or BRICS-wide coordination in your view and how they can be overcome?
Fifi, political will is one thing and execution is another, right? And Amadou is quite right. We've seen significant political will, but executing on that will depends on various agencies. And I think the starting point for me right now is that most of Africa's vaccines are procured through an entity called Gavi, and the operational arm of Gavi in procuring and the supply chain of these vaccines is UNICEF. And I think we wait with bated breath as African producers on the continent, as does the Africa CDC, to see whether the procurement reform that we anticipate actually happens in Q1 next year, because that's when we're anticipating it. So for me, that's the first most immediate step. If there is reform of the procurement processes, which means that there's a mechanism to start buying from African producers, that is a major step in the right direction. A step that would then be followed by the African governments, who themselves have to say, look, we've got this political will to do this. However, our health departments are also going to nudge Gavi to procure from African producers. And in the instance, as is the case incidentally with South Africa, where we don't buy from Gavi or we don't use the Gavi instrument, we procure our own vaccines here in South Africa, then our own government here, our own health department in South Africa, have to step up and say, look, we're going to turn words into deeds. And I think that's what we want to see. So if you ask me, how bullish am I feeling right now? I'll feel a hell of a lot more bullish when those steps actually happen and the orders start landing. Then that's a confidence builder for the future for me.
Sure. Because Morena, right now we're talking about the continent as a single entity, but I also want to break it down to the respective countries. In the event that everything right now does happen according to plan to strengthen the resiliency of the health of the continent and our ability to respond to pandemic outbreaks. When we talk about the manufacturing that actually has to happen, what are we thinking about? Just keeping it to some of the existing players on the continent that have strength in this area, like us here in South Africa, I believe Kenya and Egypt as well. And if we are talking about doing it in that way, what kind of framework potentially needs to also exist within that to ensure that some of the larger and more capable players on the continent for vaccine manufacturing don't do the same to other players in the event that there is a pandemic whereby they also prioritize their own citizens at the expense of others?
Fifi, I think that's a very important question that we need to look at in the face. So there is capacity on the continent at the moment, but it's not enough. However, we should also be careful that we do not have capacity just for the sake of capacity. So I think what is important is to make sure that all corners of the continent at least have some established manufacturing hub, the south, the east, the west, and the north. So I think as a start, we need to make sure that all four corners of the continent are covered. The second aspect I think that is important is to use existing capability that is there. I think the three companies that are represented here have existing capability and some capabilities being built, but that's being built off a lot of hard sweat and tears in building this capability. Vaccine manufacturing and biologicals manufacturing is a very hard and difficult process that one should make sure that if any new entrants come in, they come in with our eyes wide open. So what is important is that any procurement mechanism in us to get to the desired state needs to first and foremost use existing capability, because these are tried and tested, and these are entities that know what risks there are. They've made mistakes along the way, and from then they can be able to respond going forward. So we need to have a careful balance between obviously having newer capacity, but not over capacity, but more fundamentally use existing capacity, but make sure that it is spread well enough in terms of making sure that all parts of the continent are covered. But not all 54 countries will have and should have vaccine manufacturing. It's just not feasible. And so through the African Union, we need to make sure that as well that there is coordination amongst us as vaccine manufacturers, that whatever that Amadou is doing in Senegal, that is complementary to what Aspen is doing, and vice versa to BioVac as well. So yes, but I think we do make sure that all of that is using existing capability.
I think you just ending us on a point that has been echoed quite strongly within this conversation, that it will take the ecosystem, all significant players in the value chain, to ensure that the resilience of the continent is strengthened and boosted. And it is heartening to also hear the positive sentiments of you as the respective panelists, that it is possible for us to achieve a greater level of resiliency in the manufacturing of our vaccines right now. Of course, if all the points that have been raised in the discussion are addressed with urgency. But to all of you, I would like to thank you for your time this afternoon, and thank you for providing your insights. Beginning with Stavros Nicolaou, the Senior Executive at Aspen Pharmacare Group, Dr. Amadou Sall, the CEO at the Institut, Pasteur de Darkar, and also the Chairman of the Global Outbreak Alert and Response Network, and last but not least, Morena, Makhoana, CEO at the BioVac Institute, helping us wrap up Power Lunch South Africa as well. And thanks to you for watching. Until next time, goodbye.
This program is in partnership with Nedbank Commercial Banking, a banking partner that thinks bigger to guide your business growth.